picture right here, Vivace's been around for at least 5 years, so when it says that it can provide dramatic results with minimal downtime, that has been proven. This is why this device still is a best in class, top of the line, especially when we're talking for face, reduction of wrinkles and skin tightening on the face. It does provide a comfortable client experience. However, your treatment's only as good as the person doing it. So that's why this training is so imperative, to know that there's really two primary things that we're looking at when we're doing a Vivace, and that is going to dictate what settings you use. Do you go up? Do you go down? And that's going to be assessing patient tolerability or comfortability, right? So this is not a pain-free treatment. That's why we put a numbing compound prior to the treatment. But it can be tolerable and it can even be comfortable. But past that, if they're experiencing something that just feels not tolerable, we're doing something wrong with the settings. And I guarantee you, at that level of heat, when they feel that uncomfortable, we're probably putting way too much energy that's needed, more than what's needed in the skin. So we're going to learn in this training how to read the skin and know how to make appropriate adjustments from there. So a couple other things about this device: everything is customizable. So the heat that you select, the depth that you select, the time that you leave that heat in contact with the tissue, all of that is customizable to meet patient needs and the skin needs. We try to protect the epidermis. With this device, we do that in different ways. One, the way that the device is built in the handpiece and the way that the needles flow in and out is seamless. So we're not, just even the sheer force of microneedling, you really don't get that with this device. There are really hospital grade components in that handpiece that allow that easy transition of the needles in and out through the skin. We only use insulated needles, so that's another way that the skin is protected, where that means that energy, as it comes through the needles, it only comes out at the very tip. So there's no leakage of energy throughout the shaft. So we deliver that energy precisely where we want, and our target for this treatment is always going to be in the dermis. We don't want to have heat on the epidermis. We really want to cause that micro burn or micro trauma from heat damage in the dermis. We also are gonna, obviously another part of how we protect the epidermis is understanding the right setting steps, how to read the skin, and we will talk about that in the next few slides to come. Any questions so far? Again, feel free to stop me at any time. All right, so who and why, why have this treatment? Who would you recommend it to? Well, this is for anybody. I think anybody who's, over the age of, 25 to 30, we can do treatments on them because, when you look at somebody, I always put them in two categories. Are they doing treatments or procedures to maintain, or to prevent, or are we doing corrective? And this device works for either one of those categories. And what you're trying to accomplish is production of more collagen and elastin and renewal of your skin. And so we're really trying to build that dermis. I said yesterday, like a quick fix to this is filler. Filler kind of competes with this device. But filler is your instant return. You put filler in this space, you see an instant return. Vivace is more of like your 401k, your long-term investment for skin health overall, where you need multiple treatments. So we always recommend a series of minimum, at least 3 treatments, and then you can decide and work with the client, based on what their goals are. If they need more, if they can go on a maintenance program. But the reason why we say 3 treatments is because that's really what it's going to take to start seeing really significant visual changes. So we come in, we go through the epidermis and we create multiple rows of what we call electrocoagulation, or just thermal damage. We're causing damage to those cells in the dermis. It takes about anywhere from 3 to 6 weeks to repair, to have full cellular turnover. So you will cause damage, and then it'll rebuild a little bit, so it'll get a little bit fuller. Then we'll come back after they heal, and we're gonna blow up that dermis again, and we're just gonna create multiple rows of damage. They'll heal and they'll get a little fuller. Then on that third treatment, same thing. We come in, we create multiple rows of damage, it heals and it gets fuller. It's that filling of the space that is gonna create the skin tightening. It's going to fill that space where you're gonna see a reduction in wrinkles. But it is your body's natural way of increasing collagen, and we are just helping it along a little bit with a little nudge with the Vivace. So we're doing microneedling with radio frequency. So microneedling on its own, has a lot of proven benefits. You can get pore refinement and a little bit of skin tightening. It really helps to smooth out the tone and texture of the skin. So you're still getting the benefit of microneedling when we're doing this procedure. But what you're getting also is the additive benefit of like a second type of treatment, and it's through radio frequency. So while we are pushing these tiny little sterile needles through the skin and causing micro trauma, right? Because that's what you're doing, and you're waiting on that wound healing response to get those results. Now at the same time, while the needles are coming through, we're also passing a current through the needles. It's coming out in the form of heat under the skin. And so now we're creating damage in a much greater way. And again, we're dependent on that wound healing response to kick in to get the results that we are looking for. So RF, or radio frequency, is literally a current that goes through the needles and it comes out in the form of heat. That's how the patients feel it. So Vivace, RF microneedling, the whole concept is basically you're taking these insulated needles, we're putting a high intensity radio frequency through them, we're targeting that radio frequency to go into the dermal layer, and then obviously your technique and the amount of pulses you put in, our goal is to put a uniform effect of that heat through the tissue so we can create uniform pockets of damage. We're trying to create rows of damage, and in turn, as you heal, you're going to stimulate new collagen fibers. It's going to be full cellular turnover, leading to significant improvement in skin quality and texture. Much more youthful looking skin. Oops. Well, three key things that we know that is evidence-based is that in order to get the best results, we need to have three things, and we have all of these when doing a Vivace. One, that you're using an insulated needle, so there's no option for any other needle anymore. They only are going to provide an insulated needle. The second part is that you are going to do multiple passes, so we don't just do one pass and we're done. You're going to do a minimum of 2 to 3 passes, and that's going to be at different depths. So think about in a visual, it's like looking at a cake that has just one row of icing in the middle versus a cake that has 3 rows of icing. So we're trying to maximize where we're in the dermis, that we're going to do multiple rows of damage, and in order to achieve that, you have to change the depth with every pass that you go in there and do. So your first pass is always going to be the hottest and the deepest. And the reason why is that, first of all, you've numbed your patient and they're going to be at their peak efficacy of numbing as we start the procedure. So we want to take advantage of that. Second, I want to go to my hottest pass first. And so in order to do that, I want to bury that the furthest point away from the epidermis, because I don't want to trigger this. I only want to cause damage here. I don't want to put so much energy that I'm also causing like a thermal damage to the epidermis. I want to keep it in this layer. So our first pass is our deepest and our hottest. Then on our second pass, we come a little bit more shallow, a little bit more closer to the epidermis. And sometimes you can leave the same settings. Sometimes you have to change your approach. And if you do a third pass, now you're coming really superficial. And that's when you have to start reading the skin. Is it too much energy? Because we don't want to trigger this. We want to keep the energy below the skin, in the dermal layer. And the last thing is that you are always using a 1 megahertz setting. So on your device, there'll be a choice where it says, what kind of RF do you want? Do you want a 1 megahertz RF or a 2 megahertz? Standard, gold standard is that you're only going to use the 1. the 2 is not going to be able to give you enough drive to push that energy into the skin, and you're not going to get the clinical results that you need. So when this is kind of what a 1 megahertz waveform looks like. Think of it like a tidal wave. Deep in the ocean, you get these big, strong, tall waves with big peaks and troughs. If I took a 2 megahertz wavelength and superimposed it over here, what you would get is something that looks a little bit different. So I struggled with this concept because I always thought, you compare 1 versus 2. 2 is always bigger, it's double, it's more. But when you think of it in terms of frequency, it changes it a little bit. So frequency is like, the definition is basically, how many times an event happens over a period of time. So how many times do I wash my hands when I'm at work? It's the same thing when we talk about radio frequency and the waves. How many waves will you have over a period of time? So if I measured where that first wave starts to where that first wave ends, that time period, and I put a 2 megahertz frequency, what you have is you basically split that 1 big wave into half to 2 smaller waves. So you'd have something that looks like a camel hump instead of 1 big strong. So you can add them together and have 1 strong one, or you can take them and cut them in half. So the whole idea was that, hey, maybe where the skin is really thin, we have more concentrated waves because we don't need the strength to push it in, we'll have better results. But that really didn't pan out. Still, the gold standard is you need a 1 megahertz. So we're not going to teach anything to the 2. And if you go to select it, I think it actually even tells you now, if you're looking for electrocoagulation, hemostasis, you must be at a 1 megahertz. So 1 megahertz is always going to be your key for RF when you're doing the treatment. And here's an example of what 3 treatments can produce. And all results vary from patient to patient, but this is, let me see if I can blow it up a little bit. 3 treatments. There's really no other treatment or anything happening in between this other than some moisturizer and SPF, but you can see a significant lifting in the jaw, reduction in those deep wrinkles and fine wrinkles. I mean, I don't think anybody's client would be disappointed to have results like this after 3 treatments. And let me see here. And like we said earlier, so it's been around, it is a best-in-class device, and there's a lot of social media presence around it. Real Self has very high ratings regarding this treatment, so people know Vivace and that they will ask for it by name. So there it is, looks like this, but I just want to go over a review for anybody who's not put hands on the Vivace, and you will have that opportunity, but I'm going to start with the back of the device. The whole device weighs about 50 pounds. You can put it in your car. It's really small. It's like thin profile. And so you pull it out of the box. Really the only attachment components that it needs is to attach the handpiece, and then you also put in the holder, slide it into the case, and then you have to attach the outlet. So the plug for it goes in the back, you put it into the wall, and then where this black little button is, that's the main power source. So you have to turn it on, and then you flip the device over, and you'll see that the little button under the main screen will shine blue. You have to press that button, and then the screen goes on. If it doesn't, there's also an emergency power shut-off button here in the front. If for some reason that gets accidentally depressed, or somebody throws a hip or a thigh into it passing through, it's going to turn all the power to your device. So that's the first place I'd go look. I would just come here, see if it's pushed in, pull it out, and it's just kind of like a pull and a counterclockwise action. And then you should see the light and the power restore back to the device. So when you turn the device on, this is really the screen it's going to take you to. And this is what we call the standby screen. And why do we call it that? Because of this big blue button here that says standby. So in this screen, there's really only 2 working screens. So it's the screen that has the lady in it, and that's your standby. Or there's a screen that has this like model of a tissue, human tissue, and it says ready. So this is the ready screen. in this screen, the only thing you can do is put your settings in, but you cannot perform a treatment. This will happen to many of you, it happens to me still all the time. Sometimes you think, okay, you put in your settings and you're ready to start your treatment, but you forget to come back to the standby and press it to change the screen to ready. So you're just gonna keep hearing a little chime sound, but it will not deploy your needles until you suddenly you're like, oh, I forgot to press the button. So in standby, we're gonna put all our settings. We're ready, our patient is here, we're gonna put all our settings, and then once we're ready to go, you're gonna press the standby button because all of this is touchscreen, and it's gonna take you to the ready screen. In ready screen, you can only deploy needles, you can only perform the treatment, you can't make any changes to this. If for some reason you have to, you need to come back to that ready button, press it, so it can take you back to the screen here, the standby screen. So this is it. There's really not much to the treatment. I think once you learn what may look like a lot, but half of this stuff are just added benefits, but you don't really need to know that for the treatment. So let's just start with the middle here. Diode color, frequency, and switch. So what do those mean? When you are doing the Vivace treatment, you have the option of LED light, red or blue. So the red is associated with collagen stimulation, blue is associated with the reduction of microbes. So most of the time, almost all your treatments are going to be done in a red. Don't look at what my screen says, because here you see blue and at 2 megahertz, it's like everything that you shouldn't do. So you want to see the red lit up. The only time you would consider using blue is if somebody had active acne, and not scarring, just active acne. That you may want to, change the light if you're going to go over it, right? That's controversial in itself, but if you were going to treat active acne, you have the option to use this blue light, but everything else will be in red. So your typical treatment will look like red, and then under frequency, that's where I said you get to select the type of RF waveform that you're using. And so even though in my screen it shows 2, you want to make sure that it's in 1. So red and 1. And then where it says switch, you have the ability to switch whether you perform your treatment by releasing the needles on the side of the handpiece. There's a button there, or you can add a foot pedal. I don't think anybody really does that, but you have the option to do it. And if you did, the foot pedal would be plugged into the back of the device, but then you'd have to come here and switch it to foot. Just plugging in that pedal is not enough to get it to transfer. You have to also manually adjust it here. But most of your treatments will look like this. Diode color red, frequency 1, and under switch you'd have hand, because we're doing a hand deployment of the needles. Up here it says P1, P2, P3, P4. These are like parameters that you can preset, like cell phone numbers that you save in your phone. So say I like a certain type of setting, or I start at, you can come in and put that in here and then save that setting if you like. So if I wanted to put in some treatment settings, I would hit this P1. Let's say, for example, I'll start there, P1, and then I have to hit treat settings, this button underneath. And now I'm prepping the device to get ready to save my results. So say I want a power level of 5 with a depth of 1.0 and an RF time, and we'll talk about all the stuff what that means, 500. Then I would hit the save button. So these features, you don't have to do anything. I personally don't use them, some people love them, but you don't need them to do a treatment. It's just good to know that you have these additional options. So you'll hit save, and say you come back and you want to recall those treatment settings, you have to go back and hit the button you want, P1 and treat set. So anytime you're pressing one of these buttons, you have to hit the treat settings along with it. So P2, I want to save some settings. I put in power level 4 down at the bottom, a depth, again, maybe I want 1.0, an RF time of 800, and then I hit save. And if I ever want to bring those back up, I just have to hit P2 treat set. So they'll review all this stuff when you do your hands-on treatment as well. Okay, so these are options, but they're not necessary, at least the P1, P2, P3, P4, and that treat, set, and save. But now this last row, that's your workhorse, and it's really important to have a strong understanding about what all these buttons do. So when we're doing a Vivace, you know, you want to take consideration 3 things: how much heat, the intensity of heat that you're putting into the skin, the depth that your needles are going to go into, and then the time that you're leaving that heat on in contact with the skin. So level, think of that as like power level or heat level. When you know, everything is touchscreen, so that goes 1 to 10 when you're doing the power levels, but don't be intimidated. You don't have 10 power levels to choose from. When you're in a 1 megahertz, you're only going to use power levels 4, 5, and 6. So you only have 3 heat settings to choose from. And I want you to think about it like if you are cooking on a stovetop, just the same way that power level 4, think of that as your medium heat. Power level 5 is going to be your medium high heat, and 6 is like your boiling point. That's your high heat. So you have medium, medium high, and high heat. 3 settings. Those other settings above that are higher than that, that was meant for a 2 megahertz, and so we're not even gonna go into that. It makes it a lot easier just to know you're only gonna use your power levels 4, 5, and 6. As far as depth, this device has a range. It can go as shallow as 0.5 and as deep as 3.5 millimeters. So that's a great range. Again, I told you that people use this device for other things, you know, that are considered off-label. So, you know, maybe that level of depth is great for other things, but on the face, 3.5 is extreme. We really recommend not going deeper than 2.0. And the reason why, especially if you're used to doing microneedling without RF, you might have the luxury to go deeper and get in that deep dermis, but somebody have a question? So cute. So we don't recommend, you know, on the face going these aggressive depths, because like I said, when you're doing microneedling without RF, you have the luxury to do that. But when you add RF, RF kills cells. It doesn't care where it is. Heat, you put in your cells and it's going to make those cells, it's going to damage them. So I don't want to be so aggressively deep and that I'm in the fat and I'm damaging those cells, because the reason why somebody's, you know, having a Vivace is to help rebuild collagen, and that is to minimize the risk or correct volume loss in the dermis. But I could also create volume loss if I go in and destroy fat cells, and then you'll have a patient that has skin laxity. It's like, you don't understand why. So there's no point. The guidance that we get comes from a physician in California who's also a really big researcher on RF. And so he's like, hey, as long as you're in the dermis, you don't have to go deep derm. As long as you're just in there and you create multiple rows of electric coagulation or damage, you're still going to get great results. So we are a little conservative on the depth settings when using RF. And then last, but we're going to review parameters for all this stuff. And then last, we'll say here, RF time. Once you say, hey, I'm going to start my patient at a medium high heat, we'll start there. Most patients can, that's enough to get that electric coagulation, but you know, can they tolerate it? So say I want to start them at a 5, a medium high heat. How long I leave those needles, that dwell time in the skin, or how long that energy is being released, that's your RF time. And so the range here goes from 100 milliseconds to 800. I'll tell you right now, 1, 2, 300, it's way too fast. Way too fast, and you can't guarantee that you're going to have consistent electric coagulation, and that's what we want. So anything 400 milliseconds to 800 is fine, is in a great range to use. 500, to give you an idea of like time in a different measurement, 500 milliseconds is literally half a second. So half a second. If I go to 600, that's a little bit longer than a half a second. 800 milliseconds is just shy of 1 second, but we're still talking really fast times. But to the skin and to the tissue, it does make a difference how long you're leaving that heat on before it turns off. So you'd expect that the higher this number is, and a 500 would be a lot faster. You'd see the needles come in and out a lot faster. At an 800 RF time, the needles would stay in a little bit longer before they came out, right? Because we're leaving that energy in the skin a little bit longer. And then the last important thing in this row is where it says shots. So the device counts for you. Every time, you put energy into the skin, which is the same thing. When the needles go in, how many pulses we're delivering, it counts it for you. And this number, it matters because, when I go on Instagram and I'm looking at stuff people post, sometimes I just feel like, you've got to be kidding me. So technique matters. What you're trying to do is build rows of lines. And think about chain link fences that literally overlap. So every time you're doing a pulse, you're doing a 50% overlap for a couple of reasons. But, one is that the surface area of the needles is really small. So it's hard to predict. Am I doing exactly 50? Is it 35% overlap? Is it just next to each other, but no overlap? And all those are fine. What we don't want is gaps in between those pulses. When somebody's done with a Vivace, they should look like they have a uniform suntan across their face. They shouldn't look stripy, areas of white and red. They should just look very uniform and even distribution of erythema. So shots is a really good indicator on how close you are laying your hops with your pulses. So when we say one pass of the face, that just means one full treatment of everything on the face before we're going over any area for a second time. So after one full treatment of the face, you should be at a minimum of 400 shots. If you're not, that would be a really good indicator that, we would probably have to be doing our hops a little bit closer. So like I said, when I go on Instagram and I see somebody 1 point, they are holding the handpiece and there's great music and great energy, but then you're seeing that they're, putting one shot here, they're just mindlessly putting it all over the place. Is not the way to approach a Vivace. You really want to be focused and keep working on building these little chain link areas as you go through your treatment. In total, after you're done with the treatment, so your treatment may be 2 full passes or 3 passes over an area, but you want to be in the range of 800 shots minimum to 1,200. If you're in that range, that's fine. If you go over, that's fine too. I do that plenty of times. I kind of look at it this way. If I have somebody with a really small petite face, 800 is perfect. I could get that in 2 passes. I can hit that easily. For a medium-sized face like mine, I shoot for 500 shots on my first pass. That's what I'm looking to get a minimum. And then people who have larger surface area on the face, 600. So that's why they say the range after you're done with your treatment should be somewhere between 800 and 1,200. But the goal is that you want to hit those numbers after your second pass, because then that gives you options. If you need to do a 3rd pass, do you have to do the full face, or can you just spot treat the areas that may need more attention? But if you have done 2 passes and you're not at 800, then I would just say just go for a full another pass to make sure that they get enough energy to get the clinical results that they need. Trust me, this will make sense when it all comes together in your live training and you see the technique and how we're counting those shots along with it. So any questions about these screens? Because this is going to be your workhorse. These 2 screens, this is where it all happens. And I just want to show you one last thing. The depth. When you change the depth in this screen, so you're setting your treatment parameters. So right now they put here 3.5. I would never use that on my patient, but I think it gives a really good visual on the next screen. So I'm ready to go. I press ready, and now I see up here, I'm looking at this tissue model, and I see these little red dots. And this is a gauge. So when you change the depth, with every change in depth, when you go back to the ready screen, this will give you a guide of where you are. It doesn't mean that that's true for everybody, no way. But it's just, it's just kind of a based on healthy skin model where you should be somewhere in the dermis. So if I follow this line around, like here it looks great, you're in like the deep dermis, but if I turn the corner, you literally see that in some areas it looks like you're in the back in this photo. So again, I would just say cautiously, don't be very aggressive when you're treating the face because you do not want to get it. Fat on the face is good. The only time I'd see people using this level of depth, again, it's off-label, is when they are trying to go into the fat in the submental where they go high heat and deep. But again, that's considered off-label and that's a provider's practice, but otherwise you'd never put this kind of depth setting on the face. So if I change this here to 0.5, suddenly this line will be like right up here, because at 0.5 is when we're just getting past that epidermis and we're starting to hit the dermal layer. So it would take us really superficial up high. But you will notice this line moving. Just don't think it's actual. It's just meant to be as a model to give you some, guidance in that area.
Hey, I have a quick question. Can you hear me?
Yep. Absolutely, yes.
Okay, so we know already that when we do, whether it's 2 or 3 pulses, our first round is going to be the deepest, right? So
yes.
We're going to change that depth to more shallow on your second round. My question is, as people are getting treated, so say we do their first treatment, they come in for their second treatment or third, whichever, is there anything that we're increasing in intensity, or is it not really about that? Is it more so just the treatment itself that kind of stays the same? Does that make sense?
So you're not, okay, so here's the thing. When you come in, when you're starting, there'll always be a test. So you're gonna do like a row of tests. The skin changes, it's fluid. So right. I could have had a stressful event, I could use a new product, I could have been out in the sun, I could be dehydrated, I could be sick, I could be a million things, right? So what the skin tolerates today does not mean the same will happen in 4 weeks from now when they come back. So I do use that information, but I don't base it. So I will always do a test, and my goal when the patient is in is to find the highest level of heat with the longest level of RF that they will tolerate on that day. So it's always a new starting point for me. I always try to maximize the settings. And when you do your first pass, right, hottest, deepest, now you're getting ready to do your second, so you're changing your depth settings, but that doesn't necessarily mean that you have to change your power level settings or your RF.
Cool.
Because maybe as you start you're reading the skin, so if the patient can still tolerate it, I'll try to keep that on as long as I can until I can't. The reason when I decide I can't, it's going to be because the patient's like, this is really uncomfortable, or the skin is showing signs that I'm putting so much energy that it's now becoming reactive, and I can read the skin on top.
Perfect. Thank you.
Thank you. Anybody else have any questions? All right. So, talked a lot. Oh, there's some open chat.
We have a question over here. What is the time frame on the second and third treatment? Like, how far apart do you do those?
4 to 6 weeks apart. It's fine if they come later, but you really don't want them to come sooner than that because it might be a little bit more uncomfortable when they do the treatment because they have not really healed. So it just becomes a little bit more uncomfortable. So we want them to maximize that healing time and then come in and blow everything up again. So this came in here from chat. So when my clients come the second time, it's more tolerable because they know what to expect. It could be because they were on their mental side. Yeah, so many things. So I've had people who couldn't tolerate it like had very low tolerance, so we take a different approach to the way that we do a Vivace when that's the case. And then you come in then another time and they're like, oh wow, I can't even believe that, you know, we've gone up in the heat because it feels better. It varies, so we always, for me, I never just start a treatment on this, let's say it's their second time back. I don't just look at what I did last time and start there. I have to do a test again and start from that point. All right, so here's what the, you know, so you have the handpiece that looks white, and then you attach the needle cartridge on top. There are 36 needles. They're all golden coated except for the tip. They are like kind of in a square shape, 6 by 6, filling up the rows. This is a one and done cartridge. So you have somebody in the chair, you're gonna do your treatments. You can do multiple body areas. There are devices out there that will say, you know, the needles start getting dull, or they'll lock you out at 1500 pulses, meaning 15 times, you know, that a needle penetrated the skin. But this is like 15,000. So there is no getting dull. You can use this one same cap on multiple areas, but it has to be done in that one, you know, treatment time where they're there. You can't save it and say, come back tomorrow and we'll do another area. You gotta dispose of it. And then here's just kind of what I keep talking about, these insulated needles. So they're literally golden coated down the shaft, so no energy leaks out. The only place where that heat or that energy comes out of is at the very tip. So it's exactly where you want it to go. It means, you know, you deliver that energy with precision in the dermis. And this, again, this is a good thing because you can use these kinds of needles safely on your skin types 1 through 5, because, you know, as you're going through the skin and you're passing through the pigment, you're really not trying to trigger that. You're minimizing the risk of that. So you can use it safely on all the approved skin types, and it helps protect the epidermis. That still doesn't mean that we can't pull heat up through our technique, or we're putting so much heat that it's like filling up a cup and now it's overflowing out, and we, you know, so we can still cause damage to the epidermis, but we're going to talk about how to minimize that. Now, all right, so this is an example, kind of like an animated visual. You have your handpiece lined up to the skin, like you're ready to press the button and release your pulses. So this is literally what you're going to see. Even though this one, a light will go on. You never move the handpiece when the light is on. So you want to put it in position when it's off, and then you won't move it until the light turns off again. So this is kind of, so the needles go in, energy comes out just from the tips, and then it'll turn off, the needles will come back up, and the light turns off. But I mean, this is happening this fast. It's super, super fast. But that's the whole goal. And so now I have to do a 50% overlap. So there's my first pulse. Now I have to hop. We don't drag, so we always do like these small little bunny hops. Basically, I would want to line up my next pulse, like if you see kind of where the back ends, somewhere in the middle. So I can do that 50% overlap, crossover. Does that make sense? That I wouldn't hop this handpiece right here. I wouldn't just go right next to my next shot. I would go in the middle somewhere because I'm trying to do that overlap. So we're talking like really small hops when you're doing this one much. The cool thing is that you have an auto feature, but I recommend you first start manually and get really proficient with the timing and your technique. So do it manually. And then when you're feeling like, hey, I should try it, the way you get into automatic mode is by holding the button. You'll hear it chime, and then you'll see that it's just going automatic. So please get comfortable with your manual first before you try automatic, because you can cause a lot of what we call tracking, and I'll show you pictures of what tracking is. So tracking is an undesired post-treatment effect, and we always try to minimize it. I can't say that you can always eliminate it completely, because you know, you can think that all your settings are great and everything is looking wonderful. You're getting great erythema, the skin is staying flat. Those are the things you want. You want to see erythema, and you want the skin to remain just flat as is. But now, you know, you've moved halfway through the phase, and you look at your starting point, and you see that now you're seeing some raising of the skin. Almost looks like a histamine response. So maybe that they might get a little bit of traction there, but anytime you see that happening, you have to make an adjustment to your parameters, even if it's a delayed response. So we're going to look at some of those pictures here coming up. So the tips for the treatment, they come sterilely packaged. They're one and done. You can use them on multiple body parts, but you want to make sure that when you attach it, you open the package. You want all the needles to be fully retracted into that case. You don't want to see them sticking out like this. Then you will hold the handpiece upright, just like you see in this first photo, not to the side or upside down. And then you're going to attach. You're going to see, like on the handpiece, there's these like little notches on each side of the handpiece. It doesn't matter.
Products in there.
I'm sorry? Do you guys have a question? Okay, so you'll see that on the handpiece, there is like these little notches, and on the tip, you see where it's etched. To kind of line it up, and then you twist, and then you give an extra twist until it clicks in. You've got to make sure that it clicks. And then you're ready to go. So that is that. Who can do this treatment and who should not? I mean, I think there's just two things right off the bat that should just always say no. You know, no in your brain. So if somebody has a pacemaker or defibrillator, this should not be the treatment for them. And if they are pregnant or breastfeeding, it shouldn't be the treatment for them. Hold on, I have something in the, okay. Okay, so let's just make sure everybody's muted. Thank you. So those two things, they matter. So if somebody has a pacemaker or defibrillator, that's an automatic no. If they're pregnant or if they're breastfeeding, automatic no. Oh, why not breastfeeding? Because it's the same thing. No one has data on this. We know for our studies that the energy doesn't go past the skin. So we're talking super, super shallow. It's not going past any of the tissues unless you put the needles like in the fat, then the energy will be there. But it stays right hovering the needle. The reason why they say not breastfeeding is because nobody wants to take any risk when it comes to that. Could it potentially go there? Probably not, but you know what? Nobody wants to take that chance. So you know, when it comes to pregnancy or breastfeeding, you know, you have to be ultra conservative. And that goes with anything, whether it's a medication, a product, it's always going to fall under that.
So we did talk about this yesterday.
Yeah, oh, okay, now I get the question. So it's just, you know, it's better safe than sorry. Think about it. We're not, unless you're treating the chest too, that energy isn't going to travel through the body. It's going to stay localized to where we put it. But it's that ultra conservative regulations when it comes to that. It's just not recommended, because had we studied that to say, yeah, we know 100,000% that it doesn't go there, there's just zero affect, then we would do that. But we can't. And you know, the other reason too is that you can't control where providers are going to treat. People treat stretch marks on the breasts. You know, they'll treat the décolleté area, so they'll be over, you know, potentially a pacemaker. And the settings that are chosen, they're always provider driven. So just because I'm sitting here and giving you some guidance on parameters does not mean that that's what you have to use. They're always up to the person using the device. So these are precautionary recommendations because we cannot control all those variables. It's always the provider who's gonna make the decision on how and when and why they use the device. So just being ultra conservative, that's why.
So
all right, so
minimum of 2.
your pacemakers, defibrillators.
Yeah,
and no
she said
pregnancy
she
or
won't do
risk.
filler, or if they have filler,
Sorry,
she just
better
got it,
questions.
she would make them wait 4 weeks.
Okay,
She said
so
she sees
just going into
protocols
this
and
now,
every
so
2
then
to
you
6
see
weeks.
here it says patients with
But then
metal
also just
components in the
mindful
body.
that filler,
I've never
and
seen an issue,
depending on
again,
however
the
old it is.
energy
So,
stays
if
bipolar, so it stays between
maybe
needle
a
to
little bit
needle.
lighter on that area,
Um,
kinda.
However, because metal is known to transfer heat, this more applies to areas in the body that are not really the face, like metal plates where people may want to do a treatment over that it could conduct and be a little bit more discomforting. So if ever you had somebody say that, because of a metal crown or implants or anything in the mouth, you could always just roll up some gauze and put it in between the lip. But I've never had that, and I've done many countless of Vivace. So, again, I also stay within the recommended settings, and I read the skin and I read the patient. So that would not be an issue. But if it became an issue for your patient, and they're just feeling this area here, you guys, it's super sensitive, just like the forehead. These two areas are going to be like very, very sensitive. The skin is thin, you have a lot of nerve endings, so that is not, this kind of pain when they feel it like in their teeth or in their mouth. So not like the kind of discomfort that we're trying to numb and minimize when we're doing the procedure. Okay, so that's what that means, but you always have the option to roll some gauze if they verbalize they have discomfort, but I've never seen it.
Me too, but it's just me.
Okay, now it's, filler and injectables in general. You've got to really be careful on how you approach patients like this. So classically, if you have somebody coming in and they want both, they want a Vivace and they want injectables, whether it's neurotoxin or filler, you can do that on the same day, but it only works in one way, that you do your filler first. You do your treatment first, then your injectables. It can only work that way. Treatment first, then injectables. You can't do it in reverse. But if a patient comes in and says, I have either of those, the first question you need to ask is where they had it and when. Because at a minimum, you need to wait 2 weeks from when they have new filler or new neurotoxin. Now,
Enjoy.
your medical director there should provide guidance on what your policy is, so please check with them. For us, it's 2 weeks. I personally wait 4 weeks because that's, where I feel comfortable, but the minimum is 2 weeks, and you guys have to have some guidance by your medical director on what you want to do for those 2 things, but it cannot be sooner than 2 weeks for sure. Other things is that if somebody has active tumor or cancer on the face, you're not going to go over that. If they have allergy to the numbing compounds, you can always try to change and get a different compound, but then they're not going to be a good candidate. And then, the typical, if they've been on Accutane within 6 months, and also if they've had new keloid scarring within the last 6 months, you don't want to do this treatment on it. Sorry, 1 second.
Retinol, who's using retinol now?
What about retinol?
We're going to talk retinol.
I think you got me, there you go.
Yeah, sorry. So so retinols, we advise patients, so we have a good candidate. We always give them a couple of how to prep for the treatment. One is come in with a clean, dry face, ideally. Stay off retinols, glycolics, or any acids for at least 5 to 7 days prior. And also, don't use any topical, self-tanners and things like that, because you don't want to needle that into the skin either. And the same thing is true post-treatment. We want them to stay off those products the same amount of time, 5 to 7 days, before they start introducing that, just to give the skin, on the surface. Because sometimes, again, they may have some tracking, we may have brought some energy to the skin. I tell patients, and we'll go through the post-care instructions, but if you're good within 3 to 4 days, then you can start the products. They know how to read their skin. So, but if they're still reactive, uncomfortable, or red, they should not be adding more triggers to that until we can resolve what's going on. Usually, you know, the provider will prescribe them to take a antihistamine or something, and that tends to resolve any lingering redness or swelling that the patient has. They may have a true histamine response to it. And then the last, question. Yeah, I hate this. So this, where it's, I just bypassed it. Number 2, where it says patients with mental disorders, this comes standard, honestly, with all devices. It needs to be rewritten, and I know there are companies trying to kind of find a different way to word this, but it is just meant that you have somebody with the right expectations lined up to the right treatment. That they're not thinking they're gonna walk away like a facelift result, or you know, the kind of people say, I wanna look like this exactly. It's just really having the right conversation, setting the right expectations with the patient so they're not, one, first of all, disappointed, you know, 2, then that carries on to the practice and you have somebody that can, you know, potentially be hounding you, angry, you know, so it's just setting the right expectations, knowing what they're looking to achieve and what this treatment can do. And that should be consistent with any kind of aesthetic treatment people do, whether it's device or not. Okay, I had my friend have a histamine reaction. The next day she took Claritin and her skin looked amazing. 4 days later after 1 treatment, yeah, she did get some tracking. Okay, usually this goes away in a couple of days. So all of this is true. So somebody just sent this in that they had a friend with a histamine reaction the next day and they took some Claritin and skin like cleared up. Amazing 4 days later after 1 treatment. So she did get tracking. If this happens, it usually goes away within a couple days. So the extent of tracking, it matters. So I think you're very superficial, like tracking. Yep, we tell them on the 3rd day when they start to see it, just apply some light friction when they're washing their face with a towel, and that usually takes care of it. But you're gonna see some photos of tracking that isn't like that, and it literally can take, on some people, it can create like a transient hyperpigmentation. And so learning to read the skin is gonna be really important. And then the last part of this, hold on, sorry, another question. What do we do? So what do we do when tracking happens? Well, my goal is to teach you, try to minimize tracking to begin with. And if you have tracking, that it's just that really superficial, that flakes off, you know, patients will say it feels a little bit sandpapery there. They know, it's, you know, I set those expectations first of all with all my clients. You may experience a little bit of dryness in some areas that feel a little sandpapery. If that happens, you know, then we'll just start a light exfoliation with your towel when you're washing, you know, with a face cloth. So, but I'm gonna try to minimize that with the settings that I choose. So I don't ever just say that that's never a potential. It can always be a potential. You're welcome. You're welcome. All right, and then the last thing is where you see all these conditions and severe hypertension. Obviously, the whole premise of getting this treatment is that you have a healthy immune response, and that's how you're gonna get the rebuild and that cellular turnover within a specific time. I wouldn't pick candidates that are, you know, unmanaged. So I know yesterday I said, you can be diabetic and have this treatment, no problem. But I wouldn't do this treatment on somebody who's an uncontrolled diabetic. You know, so somebody now who's struggling with healing time and circulation and they're immunosuppressed. So, and that's true for any condition. You know, if they share with you that they are still being managed, I would not. I always ask them, right, is the condition stable? You know, if that's a concern before you move on. If somebody's on a cancer medication, you know, that they're being suppressed, I'm not gonna guide them to Vivace. I'm gonna pick some other options that may be better for them during this time. And we can relook at that, you know, once they're off the medication, or, you know, their labs are more stable, or they're feeling more stable. I mean, here where they put renal failure, it's like ridiculous. Somebody in renal failure is sick and has many, many issues in many different systems of the body. So, you know, adding a risk for infection by puncturing the skin, you know, with somebody who has prolonged healing, high risk for infection, you know, poor circulation is not the way to set somebody up for success. So this would not be the treatment to go that way. Just pick, you know, your candidates. They should have a healthy immune response. Otherwise, you know, maybe it's just not the best treatment for them at that time.
Christine, we had a question about melasma.
Always comes up. Yeah. So for melasma, this Vivace is not indicated to treat melasma. It's not. So I give, you know, we try to give a little bit different guidance on patients that you know, that may be at risk for hyperpigmentation, or you know, or they have melasma. So I'll tell you personally, I selectively do treat melasma based on the patients and then having a conversation with them that if this does not work, or if it did get triggered, that we are going to have some other options if they're still willing to try it. I have actually, for melasma specifically, have seen really great breaking of the pigment. But again, that's my practice, that those are the patients I'm willing to choose to do. This device is not approved for that. And I would just say if you had somebody with melasma and they wanted the treatment, and you have people, you know, who have melasma that now it's so under control and they're concerned about triggering it, and then you have people who have active melasma. I think those are just two different categories. But when I have a patient like that, I never do a Vivace hot and fast. And that's the way most people, we always start approaching it, hot and fast, so we can just do it and be done. But I have to change my delivery. I have to lower the heat, but now leave that RF time in longer. So they're gonna get more energy, but I'm doing it so I'm not causing such a volatile reaction to the skin. And the other thing I take into consideration is my depth. I try to stay below 0.8. So I won't come more shallow than 0.8 millimeters because I just want to stay below the pigment. So I try to give them a little bit more, even though it's a gentler approach, they're getting more energy than the hot and fast. So it's always going to be provider choice. It's your choice to do it. I have to tell you that it's off-label to do that if you choose to do it. It's just the way that I also choose to do it. It's an off-label indication, but I would be selective and make sure you're setting the right expectations with your clients. I would never promise, you know, that it's going to treat melasma. I wouldn't promise that it won't make it worse. I just kind of give them all the options of what could potentially be. Does that help?
Yeah.
Yes, thank you.
All right, so like we said, we ask patients to stop using retinol, steroids, glycolics, their topical tanners, self-tanners and things like that for at least a week, wash out, and same afterwards. When you're doing Vivace, you know, if somebody has anything raised on the skin, don't go over it. We usually go around it. We don't go over hair. Hair is dirty too. That's why, like in the ORs, they try to remove hair. But also, again, if you're using very, very aggressive settings, you potentially could impact the hair follicle. For males, if they want, you know, this area of the face treated, you can have them shave the night before or in the morning, depending on how fast their hair grows. We don't go over any tattoos or permanent or semi-permanent makeup because it will break the pigment up. It won't make them go away, but it will definitely change the look of a solid to kind of broken. So it will definitely break up that pigment. And let's see, everything else. Oh, other things that you can have patients do this who are on a blood thinner. That's really one of the rare times where we say, if you see some pinpoint bleeding, that's okay, and we set that expectation with the patient. But otherwise, you should never see pinpoint bleeding with Vivace. We're literally cauterizing our tract, and when you see pinpoint bleeding, that would be an indicator that you are pressing too hard or you are too deep in a shallow area. So think depth, and then how you address that, whether it's, hey, let me check my technique or change my setting a little bit, but you have to make a correction when you see that. So patients are in, You get a consent, they if their face is clean, great, start with your numbing, but if not, just have them do a gentle cleanse, take most of that makeup off, put your numbing protocol, and follow your numbing protocol, and then we have to take that numbing off and make sure that we take it off really well. So for us, we do a two-step process, one pass to make sure we take all the product, and then we do another pass that's antimicrobial with alcohol. Okay, dermaplane. All right, let's see here. Would you recommend dermaplane before Vivace? I mean, some of us here do that. I just, again, as long as you're reading the skin when you're doing this, because you're kind of prepping, cleaning, we do that. So I think I like the results when I do a combination with this. So it's always, again, it's provider driven. I cannot say, do I recommend? Do I do it? I do. And so it's always provider choice if you want to do combination therapy, but I do dermaplane with Vivace. All right, so super important that you do an antimicrobial cleanse before you start the treatment. So for us, we use alcohol, but we want to make sure that all that numbing is off and that the skin is clean and dry and ready for treatment. So how much pressure? When you're doing your procedure, your handpiece should always be perpendicular to the skin. So here's my skin. I always hold it like upright towards the skin, so you're making like a reverse T, right? This is kind of the way you want to hold it. As the forehead, for example, curves, you can't just keep it straight. You have to adjust, still continue to be perpendicular with the skin. If you don't make those little wrist adjustments when necessary, so like when I'm flat here, I don't want my handpiece tilted one way or the other, because I want to hold the handpiece straight so all the needles come in at the same depth. The moment I tilt it on a flat surface, or I pull it, one way or the other, one portion of those needles will be deep. The others will stay shallow, and you can cause tracking with that. So you always want to make sure that you're perpendicular to the area that you're treating. And the amount of pressure that you put is just enough to make sure that, let's see if I can pull this picture up here, that the four corners of your tip are touching the skin. So I don't know how some people were trained with microneedling, that you're gonna press and push. You're just guiding this handpiece. You're not doing anything. It's programmed to deliver those needles at a specific depth. If you press, you're gonna alter that depth, obviously, and make them go deeper. So you just wanna put enough pressure that you have contact with the four corners, but you're not pressing into that part. I briefly mentioned, we wanna do a 50% overlap. So this is, when you do a Vivace, you line it up on the skin, you press the button, you're gonna see in that spot where the needles go in, what we're trying to accomplish is that we're gonna see erythema, and it usually looks like just like the pattern of the needles. You see this little square of erythema. Your next hop is gonna be like a micro hop, and it's gonna cover half of that surface area, and then you're just gonna keep building like you're building a chain link fence. And again, just some definitions. When we say pass, many of you have done it, or you've seen it done, that somebody may treat one area a couple of times and then move on to the next. We don't recommend that. We say treat everything once before you start a second pass over a treated area. The reason why is because one, we're stacking energy by doing a 50% overlap. So we're already stacking energy. When the energy's in the skin, it doesn't just dissipate. It literally sits there, and this is like a time lapse slide to show that even at 10 seconds, this is 1 second, 2 seconds, 8 seconds, 10 seconds, you're not really seeing that energy dissipate. It's kind of sitting there. So to minimize patient discomfort and triggering the skin, we just say treat everything, give that time to cool down before you go in and do a second pass and add another stacking of heat to the skin. That's really the theory behind it. So this is the slide I just really want to show you guys, because tracking is basically scabbing. So you burn through to the epidermis and now it has to heal. So this is nothing permanent or disfiguring, but it can be very angering to your patient, especially if you told somebody that they should be healed within a few hours to 24 hours. So to show up with something like this, and now this won't take a few days. This is going to take a few weeks. This is probably going to be something that needs to be exfoliated too. Like I would bring them in after they healed a little bit more and do an exfoliation on them. Oh, question, hold on. Would you ever do more than 3 passes, for example, on somebody with head acne, or not acne, but remaining scar? Okay, so when you do a 50% overlap, you're literally kind of like doing 2 passes in one, if that makes sense, because you are covering that area twice. So 3 passes would be the equivalent of 6 if you just did, your pulses side by side. Because we're doubling them up, it's like doing double the passes. So on other parts of the body, other than the face, I do more than 3 passes when I'm doing things that are off-label. When I'm on the face and even acne scarring is considered off-label, but phenomenal results. I still am going to keep to my 3 passes when there's so for scarring, it doesn't matter. Scarring, even active acne, because I do treat active acne, but I would say that it's plenty if you're doing a 50% overlap. Usually the skin cannot take more than that on the face. It's just, you're going to start seeing it look like this. You're going to start seeing things that are going to be raised. It might look like patterns of where you're, like say you built a row this way, it might look like stripy, but you're going to see the skin starting to react like it's having a histamine response. It's just angry. It will calm down. The patient will leave and probably everything will be flat and red by the time they walk out the door. But this potentially means that we cause burns here, and we won't know it for at least another 2 days when the patient starts healing and it's going to start looking, this is an extreme version. This first version is like somebody who went in max heat. So our max setting is a 6 and 600 and is just pressing through without reading the skin. So they don't care. They're just more is more, and they're just giving what they feel is an aggressive treatment. But we don't have data to show that if you do this, you're going to get a better response. You just have a longer healing time. So this is not the way to do a Vivace. But now you have to track, what we call stamping, but it's still tracking. If you look at this photo here, where you're looking like you're seeing the patterns of the needles, right? If you look at here, it's like we literally burned, like we cauterized the needles into the skin. So this is technique. This is not settings, because when you look at the rest of the photo, like on the sides of the face here, you're really not seeing it. This is all technique. I see a random pattern of a needle right here where they are pressing it too hard. And so this, again, you would see or pinpoint bleeding, or you would see, it looks like frosting. You look like little raised skins that have white caps, and then they may dissipate. Again, evidence that we pulled heat up really fast, and then it kind of cooled down and you don't see it. So, but this would be technique. This is just, the first one is way too much settings. And then let me just see if I can blow this one up. This one here on the side where you see that it is also pressed, but it's also pressed and tilted. So the side where you don't see the needles, it's kind of leaning that way, and then these are your superficial that cause this. So this is what we call stamping. It's just technique. If you just follow this one guidance that all you want to see is erythema and the skin flat and nothing else. If you see something different and you don't know what it is, go back and change your settings to a different approach, and we'll talk about that. But you can see something like this, and that does not mean that's a histamine response. That is not in the true sense of that, they're allergic to something. This is, you can verify this by just switching sides and changing your settings and see if, this stops. Because usually this is just angry skin, too much energy, so it's coming now out on the epidermis and we have to make adjustments. All right, post-care, we have like 3 other big slides that we have to cover. You've had the treatment. There's 3 options now after you're done. One is to add PRP post-treatment. The second is to use the Vivace Experience products, which is a hyaluronic acid-based serum with tripeptide, tetrapeptide, and hexapeptide technology in there with a mask. Or you want to do something prescriptive completely, and that you have the right to pick any other product you want to. So, but what is constant is that you're going to tell your patients they should not use any makeup for the next 24 hours. They should be very conscious about not touching their face. If they have to touch their face, they should wash their hands prior to doing so. They should not exercise for a minimum of 24 hours, but it could be up to 48. It just depends when they wake up the next day. If they have no redness and they look, they don't feel swollen or anything, then they can resume exercising. If not, they should wait another day. Same thing, same time frame for going into like saunas or hot showers, that are going to trigger the skin. They should avoid that for 24 to 48 hours, depending on how they look after the first 24 hours. The next day after the treatment, they can start wearing makeup. They can put a moisturizer with an SPF, and they need to still wait those 5 to 7 days for their retinols and even vitamin C, things like that. That could be a little bit irritating still. So same recommendations on waiting on those types of products. And as far as direct sun, no direct sun for the first 3 days, but they start with their SPF, like we said, 24 hours afterwards. You have to, and it is the recommendation to disinfect the device between each and every patient use. So with a hospital grade wipe, as long as it's like quaternary ammonium or I don't know, you don't want it to be hydrogen peroxide or bleach. It could be alcohol or all the other ones. And then I know we talked about our post-care products. You can purchase the needles alone, the needle tips, or what we call the Vivace Experience Kit, which is you finish your treatment, right away you add this serum to the skin, and then you put the cooling mask on top of it, which is weighted, meant to drive that serum into the skin and reduce some of that redness. Then if this is what you choose to do, then you tell the patient that they are to apply the rest of the serum all throughout the day, whenever they feel tightening or heat, just to like wash their hands and then come back and apply that serum and nothing else. So that is it with this slide, but I just want to go over, I want to show you, I'm not going to go through all the parameters, I just want to show you what you're going to review when you have the live trainer. So 1 second. Share. 1 second, and then we're going to roll into the SOMI. So we can start getting whoever's going to draw the blood for the SOMI and the patient, just we can get those things set up. I'm just going to take a minute here to find this tool for you guys. So this has probably been sent to you guys already, but it's what's going to be based on for your training. It looks like this. So we're upgrading this to also reflect the depth recommendations in the face. But You don't have to, it's not rocket science, honestly. You're gonna pick, we say a recommended starting setting for most that works is and this is again based on the studies that were submitted to the Journal of Clinical Dermatology, that a power level 5, so you have different options when you look at this chart here. So you have power level and RF time, and then something that says joules per shot. Obviously if you make a change to either one of those first two columns, it's going to change the output of how much energy for every time you press the button. So this gives you a range of what that energy output is, and it's supposed to instill a confidence that if you have to come down versus go, try to be aggressive with your heat, but say your patient can't tolerate it, so now you have to lower your heat. But when you extend the RF time, you're actually getting more total energy, and it's a lot more tolerable. So a starting point is going to be usually at 5 and 500 for most. Again, not all, but for most. And then we always treat the shallow areas first, because that gives a better guide of what you do with the cheeks. So I do my test spots right here on the temple. I don't do it up front in case they get tracking and it's just way too hot. So I build like almost looking like a finger line. I put 4 pulses and I do a 50% overlap, and then I stop and I ask my patient, hey, how does that feel for you? Is this comfortable? Is it tolerable? Because that first response may tell me if I need to come up, do I need to stay there, or do I have to go down in this algorithm? And I do move by increments of these steps. So if she's like, if they say, hey, I feel it, but it's okay. So then I know, okay, so maybe staying here is an option. Then I'll look at the skin. That's the second part. So now what I'm trying to see is, am I seeing erythema, and is the skin staying flat? So if I'm getting that response too, I will probably do another, I'll say to my patient, let's just do a few more pulses and we'll see, if we need to make adjustments. So I'll do like 2 more rows, and then, if they're that uncomfortable, then I will go to a 4. So now I have to lower, I don't want to go to a 4 and a 5 and 500. This is kind of a, medium heat with a medium RF time. So, but it's fast, even though I say medium average, I can go higher and obviously I can go lower, but if I can't drive that change with heat and they're uncomfortable here, well then, hey, I'll take it a little bit lower, but I'm gonna max out my RF.
I do.
So the only time really you can use an RF of 800 is when you're in a level 4. The highest RF I can use with a power level 5 is a 700. And the highest level of RF, the longest RF that I can use with a power level 6 is a 600. So you do kind of get to adjust and come down in heat that you can go out in time. And so you'll start here, and if you don't see reactivity, if your patient just says, I don't feel it, then up the RF time, take them to 5 and 600 or 5 and 700. You always could start people at the top and work your way down, but usually at the 6 and 600, most are gonna welt and they're gonna get tracking. Very few need that much heat to really get a reaction, but I've had 2 people that literally, I had to max them out like that, and just getting a regular response. So you never know. You always have to do your assessment, but this is going to be the tool that you use. And so just as a review, so, this device is approved for the Fitzpatrick skin types 1 through 5. Your initial setting is going to be a power level 5 and an RF time of 500. We treat the shallow areas first, so that includes temple, forehead, under the eyes all around, down the nose and the side of the nose, over the lips, all around, and that chin area. So you're getting like this extended T-zone is all going to be one depth. And then when you're done and you get to the cheeks, you're going to change that depth, because obviously we need, we have the opportunity to go deeper. Question. Oh, what about hydrocortisone cream? People can put, let me see, is that attached to something else? Would I ever do, sorry, I'm just getting into these functions. Is there any way we can get a print out of these? Yeah, so this has, the slides. I cannot give you the slides, but you don't need to worry because within like a few weeks, they will be in the marketing portal. So we now kind of teach new people. We do these virtual 1 hour reviews of the slide deck, but that's going to be recorded. So everybody can just, have their employees look at it at their own time and convenience, and they won't be live anymore. So this slide deck with a recording is going to be available in the very near future in the marketing portal. So your managers or whoever has control of that will be able to access it at any time. What about hydrocortisone cream? So some people can put prior to treatment, again, you really don't want people to be taking NSAIDs. Tylenol is okay, but like ibuprofen, things like that, if they're not prescriptive, I'd say, try not to take those for 3 days prior and post. Hydrocortisone cream, some people will apply that if they have a histamine response. You can take like an antihistamine, or you can apply it topically either. So either one of those. And then this has already been sent over to you guys, so you will have a few resources available. This as a guide for your settings. So the slides will be available to you soon, and then you guys can print them and do whatever you want. But there'll also be a voice recording attached to that in the very, very near future. All right, so your first pass is going to be your hottest and deepest. You always want to perform a few test shots to make sure that it's going to guide your settings. Okay, sorry, another question. I can send you the pre and post case. Oh yeah, yep. Okay, perfect. Thank you.
We have another question as well. What about the older clientele that have like the papery thin, translucent looking skin?
So again, I would even be more conservative in my depth. So where most people, I start at a 1.0 and then go to like a 0.8 on my second pass. And if I did a third, I'd go 0.6. For the cheeks, I tend to be a little bit more ultra conservative. I think most would start at a 1.8 and then on a second pass go to like 1.5, and on a third pass go to 1.2. I tend to personally go to 1.6 on the cheeks, and I would probably start them at like a 0.8 and then go to 0.7 and then 0.6, because there's not a lot to work with. I don't want to be in the fat, and I need to rebuild that skin, so it's especially good like that. I've just seen really good results when I am more conservative in my depth. But I'll tell you too, I like the combination. If I can do 5 and 500 on my first pass, and even if I have the option to stay there on my second, sometimes I'll just change and go to a 4 and 800, so they have that benefit of that like slow cooker, low and long RF. So if I can't, when I have skin laxity, I'm really shooting, I want to get the combination of like, if I could do a 5 and 700, even just in a few pulses in those areas. But if I can't because they can't tolerate it, then I will always try to give them that benefit of long RF in there and do a 4 and 800 in combination. So 5 and 500 and 4 and 800 are my most go-to settings. Sometimes I have to go higher, but I will try to spot treat, especially when there's skin laxity, to try to do early and long RF time. But most can't do the 600. I really want that longer RF, so 5 and 700 is actually more ideal for me. I would just be really conservative in your depth settings when you have people that are that paper thin.
She said
who really
they have
need
to do your assessment over every time they come.
Okay, so, all right, perform 3 to 4 test shots. And again, your assessment is ongoing. Always kind of come back to that starting point and relook as you're going. You want to make any adjustments and keep reassessing as you're going with the treatment. You always want to do a 50% overlap. You want to complete 1 full pass of the face before starting the second. And then with every pass that you do, you want to bring your depth a little bit more shallow. And then you want to aim to deliver anywhere from 800 to 1200 shots per total face treatment. So this stuff will all be reviewed for you guys on your next on your live trainings. So any other Vivace questions before we roll into Somi? And you're gonna have, again, a live trainer there who is gonna bring it all together. This was just to provide a base, set some expectations, and introduce you to the device. Cheers. Well, in addition to buying Vivace, you also purchased the Somi skincare line. So I'm not sure if you all are familiar with it. Somewhere in the slide deck, there's a little like mini commercial that shows you what the product looks like. But we're gonna roll into Somi. I would have, oh yeah, let me see here. Hold on, let me see the Oasis room. I can just zoom this. Let's see this one here.
Yeah, we'll have to have it.
All right, it's hard for me to see, but do you have so for the Oasis room, do you guys have the kit on the table there? Yeah, I can see blue things, but it's hard to make out what they are.
Yes, I have.
And can that room unmute? So thank you. Can I hear you now?
Yes, hopefully.
Oh, yeah, I can. Perfect. All right, so let's leave this communication open. Everybody else can stay muted, but unmute at any point that you have questions. So there's a couple of things happening here. Not only did you purchase, this, what we call the Somi skincare serum, but you also purchased a new centrifuge in order to draw blood and separate and spin out PRP. So we're gonna do a combination of training, but first I just want to review a little bit about the Somi product and PRP in general, and then we will focus on doing the blood draw, spinning it, and adding that PRP to the Somi skincare. So a little disclaimer, because anytime we talk about PRP, which stands for platelet-rich plasma, that falls under the purview of the FDA, and basically what that means is that there's always regulations, federal regulations around that, and so there should be, consent when you are doing anything around PRP with your patients. It's my job to make sure that you're well informed, and your job to make sure your clients are well informed, that they know all the scientific rationale and just feel well informed on the product's use. So, all right, always have to just throw that in there. Let me see here. So, Somi, obviously it's like a play on word, skincare, that's all you. It's because you are actually adding your own growth factors, your own platelets to a serum and creating a customized skincare that is specifically yours and for you only. So, quick history for PRP is that, let me see if can you guys see this? Let me see if I can blow this up a little bit bigger. There we go. So you hear a lot about PRP now, but PRP really started in the 70s. Obviously, hematologists created or coined that term just so they know that they had concentrations of plasma that were different than just what whole blood had in it, and they used it for transfusions, of course, for patients that had low plasma. It then kind of caught attention, especially with this study and this dentist who was like, the 80s had hit and there was a lot of fear around HIV and AIDS, and so cross-contamination was a big concern. So this dentist started taking PRP and was adding it with his bone grafts. And the photo that you see here is probably one of the most famous. It is definitely the first photo that was captured to show the regenerative properties that PRP has. And so this dentist was able to demonstrate that when you use PRP, you could enhance your bone graft outcomes. And by using what we call autologous donations, meaning the patient's own donation, it really eliminated concerns of disease transmission and any kind of immune response to a foreign body. And in that first photo, what you see is like the degradation of bone in the trabecular area. 6 months post-graft, you see like all of that bone area repaired and re-healed, so by a significant percent. So this really was the kind of the foundation of where everybody else now took platelets, because you went to ortho, went to so many different areas, and it also made its way into the cosmetic arena. Oh, why am I going backwards? Sorry guys. Also made its way into the cosmetic arena, and I think this isn't the photo, but it looked like this. It was like Kim Kardashian, like this bloody vampire facial. Yeah, that was a long time ago. Nobody should be having bloody vampire facials anymore, because our centrifuge technology has gotten so much better that, you know, it can separate and concentrate plasma at a much more efficiently than what we were seeing here. So now PRP in aesthetics is used as topical and as injectable, and it can be for things like people mix PRP with filler. They use it for hair restoration injections, O&P shots for sexual enhancement, with fat enhancement. For topical uses, you know, you have the facials. You also have, you know, people microneedle it in. You should not microneedle it with RF though, because we said RF kills cells, right? So when you're not using RF, that is an option. Otherwise, you put it post-treatment if you're doing an RF treatment. So lots of different ways that people are maximizing the benefits of PRP in aesthetics. And one of the ways that, you know, our company has been able to do that as well is by creating a patented serum that can keep platelets alive for a minimum of 90 days. And that's what we tell our patients, up to 90 days, but technically our data shows that it can be as long as up to 120 before you see significant die-off of the cells. So why is this revolutionary? And it was voted one of the most innovative cosmetic products last year with Allure magazine. It's because there's nothing else out there. You can get products that have growth factors and have all these other biologics, but they don't come from a source that you know. So, or they're animal source, or they're, you know, random sources, but this is your donation. You're gonna give your blood. This is gonna be your PRP. Your body knows your own body. And so now you get to have, like at point of care, a PRP treatment, a live PRP treatment every morning and every night. And the studies have really shown significant, oh, sorry, I have a question.
So if you get certified in phlebotomy, you'll be able to draw the blood.
So again, that's state by state. Nurses can draw blood in any state that they're certified in, but if they're not a nurse, then you need to have somebody who has a phlebotomy certification. That is correct. So that is very, very correct. All right, so now you have a serum. This serum has 22 ingredients, which again, when you think about cosmetics, is pretty unheard of, because it's rare that any cosmetic has less than 50. It's usually 50, 80 or more. So there's 22 ingredients, and the ingredients that are in here really are to do two things. One is the preservative package that is meant to inhibit, obviously, any kind of organism from growing, and it was also tested specifically for bloodborne pathogens. And then the second component of the serum is are ingredients that are made to create the cellular environment. So the cells feel like they are not going to be stressed, they have the right food source, and we'll talk a little bit about that. And when you add the PRP, that is 23 ingredients in total. But what you get is autologous skincare, so skincare that's all you, it's customized, created just for you. It has definite proven anti-aging properties with reduction of fine lines and wrinkles. It refines skin texture, improves dryness, overall healthy yet more radiant skin. The cool thing about this product is that it's one thing when you're putting PRP on the face after you've created channels for that to go through easily. The studies that were done for this product have nothing, nobody created channels. It's literally just the PRP, because, let me see what this next slide is. Here. Hold on, you guys, I'm like frozen. Alright, I have to do this. 1 second. Stop sharing. Reshare. Okay, let me see now if it works. Yep. Okay, here, let me just show you this quick little video. And then I'll answer the question that came in. Alright, so I have a question that came in. It says, so do you use the sewing product for 90 days after getting Vivace? Alright. So you can use this product in different ways. It's really about maximizing one return on investment, you know, for you guys as providers, and then it's second of what are we trying to accomplish as far as skin goals with our patients. So I'm going to table that question just for a second, and then we're going to get into the ways that you can kind of package that. Oh, this keeps freezing on me. Stop. All right, let's do this one last time, but what I'm going to do is go to this version. Make this bigger. Let's just do like that. Okay, so I mean, this, sometimes they say like a picture says 1,000 words. Here you have a platelet cell. Platelets on their own are way too big to penetrate the skin. So really the magic is what all these little things that live inside the platelet that are housed. That's what makes the difference. So that's what's so important, to keep the cell intact and viable. And then we want it to stay alive until the moment we put it on. That's what we need for that cellular wall to break. And the way that we accomplish that is, you know, one is going to be through a temperature change, because this product will be refrigerated. So when you go from that change of cold, you know, to room temperature on the skin, that's going to start degrading those cellular walls. But we also add a mechanical element by lightly adding friction when we're putting the product on. But it is the makeup of all these biomolecules that live inside the cell. Those are the things that are small enough for most of them to penetrate the skin. And so we know that because in these studies, we did not create channels. This was just plain skin that they applied the product day and night, the same way that we're gonna teach you to educate your patients on. Okay, so that's, let's see if you can see here. There you go. So this is what the bottle looks like. It comes in a big box. You'll see that I have a label on mine. We'll talk about that. You definitely want to label your product. But it has 2 preservative packages. The first one we said is a platelet additive supplement that really has things like glucose and sodium bicarb and sodium glucate, all of the things that are present in a normal cellular environment at the right ratios to make this cell feel that it is safe and it's not stressed and doesn't need to open and dump the contents out. And it also has things like, you know, to balance the pH, because, you know, all those things will help delay platelet degranulation or the platelets opening up. And like we talked about, then there's that other second preservative package in there, but that is all natural. You cannot put harsh alcohols in this product because it would kill the cells. So this is a patented technology preservative package that has things like honeysuckle and thyme and all, like, it's very natural based, but again, very effective in the prevention of any microorganisms growing, and even in the presence, after testing in 5 minutes, those organisms are no longer viable. So there are actually 2 clinical studies for this product. The first one was done over 8 weeks, and it was conducted by Dr. Zoe Draelos, and it was a split phase. So half the phase had the serum and PRP, and the other half only the serum. But funny that even in that group, they saw improvement. But it was randomized, investigator blinded, 20 patients, and the only other thing that they used the same centrifuge that you have there, but they also used a roomy therapeutic massager to put the product in. We don't use that anymore, but it was used for the products. And I think, you know, this really tells a significant story. So when you look at, you know, skin and skin health, we know obviously that collagen is a key driver, elastin. So they looked at those endpoints, but they also looked at something called the Redipeg. And so let me just start to explain what all this dyeing and color coding that you're seeing. Obviously they stain these slides. The first column is pre-treatment. So that's your control group. This is prior to initiating treatment. And so let's start in that middle where it says Redipeg. That is like the border right between the dermis and epidermis, and it should be, you know, in a youthful sample, what you'd see is, you know, the ability that this has a lot of recoil, so it looks like a slinky. There's a lot of hills and valleys, and you know, when you stretch a rubber band, it comes right back, versus when it's overstretched and then it loses that recoil ability. So in a healthy Redipeg, you should have a lot of hills and valleys, but here you see a flattening effect, and it's that line that's stained in red. But 8 weeks later, you know, you see a big uptake in that recoil. So this has to do with skin firmness, skin integrity, skin strength, collagen analysis. You see a lot of this red and orange. So anything that was stained in blue, there is zero presence of. If you saw yellow, that means there's traces. Orange means that there's a moderate amount present, and red is very densely populated areas of the things that we're testing for. So collagen, you see pre-control group, you have a lot of yellow and orange kind of balanced out. 8 weeks later, you see areas now that are starting to be a lot more dense, so you're seeing that transition from moderate to a lot more dense collagen areas that are just very, very scarce on that first photo here. Now you're seeing a big uptake in collagen, and in elastin, you know, you have areas where there's just no presence, trace with a few pockets of just moderate. I think to me this is the most significant slide, because suddenly you see all new formation of elastin here. You see a lot more yellow with areas that are becoming more moderate. So you definitely see that there is a cellular change after 8 weeks of using the PRP on the skin. And this was just another measure, because I said the study was 8 weeks, but they did not do any histology slides in between that. So, but they did do kind of a questionnaire for the patients comparing SOMI and PRP at 4 weeks compared to the 8 weeks. This really just represents that even at 4 weeks of using the product, they're starting to see an improvement in all of these categories listed below: dryness, smoothness, softness, luminosity, radiance, firmness, and texture. Obviously, the pink group, which is the, you know, at 8 weeks, the final, is significantly higher. So it does tell a story that with prolonged use, you know, you may get better results, but even as early as 4 weeks, the study participants are showing that they see an improvement in all of those categories. And then I think the last slide I want to show you is, let's go to this here, the centrifuge. So this is the centrifuge that you are purchasing. We do not make this centrifuge, but our company did lots and lots of researches on all the centrifuges that are out there, and this is the one that they chose to do their clinical studies because it yielded just that, you know, that pure gold PRP. You have the ability to concentrate at different levels, but compared to, again, all of the ones in the market, they thought this was superior in the way that it even performs the centrifuge process, which is horizontal, and then the tubes come back down. So the separation of the cells is done much better with this device. So I guess the point about this slide is that you should have a high confidence in the product that you pick to do your PRP because it's really one of the best ones out there. So let me stop here for a second and turn this off. Do you guys have questions about the SOMI product? Because adding PRP to here is going to be simple, but that's a little bit about background here. Are we ready to do a blood draw?
Sure, who wants to be my person?
You wanna model?
Uh-huh.
I mean, listen, if I could volunteer to get this for free, I would be.
I mean, I'll do it to myself. I'm gonna be honest with you.
With my hand up right
How are
now.
you going to get last now?
Uh-huh. Yeah, Doug?
Yay, Doug. No, I don't see. I am after.
Okay, so let me see. So you have the kit. Let's go through the kit really fast.
Okay.
Because you have a little sealed package that's your blood, like all of your blood draw equipment.
Uh-huh.
Yeah. So we're gonna open that. I wouldn't dump it out, just like open it. And if you could kind of verbalize to the other, you know, to others too that are on here so they can see, you know, what you can see. It's a little bit hard for me to see, maybe
Sure.
you can see a little bit better, but you're opening a box. Everything that you need for a blood draw, yeah, perfect, thank you, is gonna be in this kit. So right, what she's holding there is gonna be the phlebotomy kit. And then in addition in that box, you're gonna have the additional components to do your blood draw in a
I'm gonna
sense.
need your arm though.
I know.
Yep, so that is where we're gonna transfer the blood once we draw it, and then these are gonna be, yep, and that's an anticoagulant, so you need an anticoagulant with the system.
You do?
That
In my
is key.
car.
Perfect, all right. So I would open, let's just open the thing you're holding in your hand. You can just hold it. We're gonna open everything right now.
It is not mine, it's good. See? Easy.
And before we do the blood draw, let me just ask to make sure we have all the components. We have the centrifuge, it's plugged in, right? Turned on?
Correct.
Okay, do we have the scale and the counterbalance? So somewhere there should be a scale,
Uh-huh.
and that, you know, I don't know if you need to plug it in or if it's battery operated. Let's just make sure you're all set up. before we-
Work, no, work was first, work.
Oh, you have to work.
Yep, work it. Not very fast,
Okay.
not very fast.
Oh, not very fast.
Same like your, heart. Where's Alan?
She's at home.
Oh, she doing it from home? That little slut.
Yeah, it's better just to have everything set up first before we're
Just
like
like
now.
your heart work?
Still working?
For me, it's working. I don't know, but it's not working.
Okay.
Well, while we're waiting.
Scale's on.
Hmm?
The scale is on. What else do we need to do?
Scale's on and it's on 0.
Yes.
Okay, then the last part is that there should be kind of like a plastic holder with counterbalances for the centrifuge. So that should include like a big
Oh, I forgot
syringe.
about
Yep. Is there any water in any of that?
Negative.
Syringe?
No.
All right, let's fill that. Is that a 60 you have or a 30? I can't tell.
This is a 60 and then this is a 30.
I can't see a vein on it.
Let's fill up that 60 cc syringe with about 40 cc's of water.
Triple that one up, you think?
What about if you use
So
different
everybody's
blood?
gonna have to climb the scale initially, to have that counterbalance, but takes just a few seconds.
I don't see it. I don't see a vein.
Hmm?
I don't see a vein.
You may be better on the other side. You should always go with your non-dominant hand, but look at her.
This is
Got it.
not, this is the hand I use all the time.
I can feel, but I can see that. When did you leave your vans at home?
Okay,
So,
He's a
we
vampire.
have 40, 40 mils in here.
I don't know if you can get a vein or not. What do you think?
Oh,
No, not over
Okay.
there.
So, alright, so I put that big syringe in that holder, and if you can just maybe
So
transfer,
it's easy.
I don't know if it does.
you never
okay, so
Blood test?
the thing that's
Not a long
next to it,
time.
yeah.
Me too.
This is
a 30.
Maybe 3-4 years ago.
Okay, and there's like, yeah, so is there a cap on that or no?
yeah, like a lower lock.
Yeah, so let's lock and transfer 20 cc's into that.
Okay.
And we're just estimating, we're gonna have to change it, but just to start this off. We're drawing about the same amount of volume, but we'll see, we'll have to adjust it, but just to get it going.
Okay, 20.
Alright, yep, so put those back in the holder, we'll be back to that in a minute. Alright, so we're going to open all of the kits there. We have, what are you holding? I'll just kind of guide it through that. So what
I
are you opening?
have two syringes.
There's gonna be 2 syringes, one is a 20 and one is a 10. The 20 is what we're gonna initially do our blood draw with, because we're gonna draw 2 cc's of anticoagulant in that 20 cc syringe, and then we're gonna draw 18 cc's of blood.
Okay.
And then the 10 cc syringe is gonna be used after you've spun out and separated the plasma from the red blood cells, and we're gonna draw it out.
Okay.
So we're not gonna use the 10, but we'll just put it aside. Okay, so before we do the blood draw, you're gonna open that phlebotomy kit.
Yep.
And in that phlebotomy kit, you're gonna see a green needle,
Uh-huh.
and you're gonna attach it to your 20 ml syringe.
Okay.
I also grabbed like an alcohol pad.
Mm-hmm.
There should be 2. We're gonna use one of them to clean the anticoagulant.
Okay. So it's to keep the blood from clotting so that we'll be able to spin it down so it doesn't dissolve.
You inject that in, or what do you?
Oh, thank you. Okay.
Alright, so attach that green needle to 20 ml syringe, and then open up your, at one of the alcohol pads, and pop the vial cap off for your anticoagulant, and you're gonna, so maybe like displace, pull your plunger like 2 cc's back, and then go, clean the cap of the anticoagulant, go in, kind of press that extra air, and draw up 2 cc's of anticoagulant in there. And it helps to displace a little bit of that air because of that negative pressure. And we do need a sharps container.
Do you want me to go get my sharps container?
Yeah, if you don't mind, that'd be awesome.
Yeah.
Okay, 2 cc's, now what?
Alright, so pull it out, even though you're not supposed to recap. I would just scoop up that cap, and then we're gonna get rid of that in the sharps.
Okay.
That needle. Now you should have a butterfly
Yep.
needle in your, let's attach that. So take the cap off at the end and lure lock it onto your syringe.
Okay.
Okay, so you have your tourniquet, you have a piece of gauze, you have a bandage, I just make sure all that stuff's open because now we're just gonna do our blood draw and you want to get a total of 20 cc's, including the anticoagulant. So you'll do a blood draw all the way to the 20 ml line.
Okay.
All right, so now they're gonna be ready to do the blood draw.
What are these blue caps for?
The blue caps.
Yep.
Okay, so let's just put that aside.
Okay.
Because that is, we will talk about that after, but not for this part. It's once we have the PRP, you can put a cap on your syringe if you want to, walk over some PRP for a treatment or something.
Look at mommy. Don't look at the.
So it's important to know that, let's just say you need to get another needle because we couldn't get it. You should not use anything smaller than a 21 gauge. If you had to a 23, but we really say 21 gauge or greater. And that's what you have there.
Okay.
And the reason why we don't use a back detainer system is because, again, they're trying to preserve the highest integrity of the cells.
Good job.
So we're not putting so much negative pressure on it.
Are you doing okay? I can't look real bad.
Don't look. I don't want you to pass out. I had a girl seriously pass out the other day when I was doing her Botox.
There's excitement in that room and dancing.
We're just trying to get him to not look at his blood.
Are you distracted?
Uh-huh.
Okay.
I wonder if we should get him some sugar.
I said I have cookies.
Cookie. I want a cookie.
Why don't I go here?
I think that's a good
Can
idea.
you dance?
I'll do dancing. Okay. Should I show my break
Ooh.
dancing?
Yeah.
Yep. Hang tight though.
Okay. Let me hold this. I got it.
Okay, cool. Thanks.
I got this.
Okay.
All right, so your butterfly has a little, you can kind of press down and cap that needle, but we're just gonna take that needle off and discard it in the sharps.
I'll get rid of it.
You're still bleeding.
You just
You're a bleeder. Yeah, hold it.
Oops.
Oops.
Should put my hand up.
Okay.
All right, let me stop here for a second and ask about the Sony. So, there should have been some bottles sent for training. Do we have those? Okay, so she's gonna get one. Okay, perfect. So then you'll see what the caps are for. Perfect. All right, so we got rid of the sharps.
Correct.
All right, so now you're holding. Did we open the other bottle that looks like the
You want a cookie?
center
Or you
finish?
want
Glass of
We
You want water?
glass of wine.
Yep, so always
Yeah.
gloves.
Okay.
All right, let me see. So let's open that packet. Yeah, and it's always easier just to open everything so you don't have to do it, but we're all figuring it out. Okay, so there's a cap on there,
Uh-huh.
a red cap, right? You see it?
Yeah.
Correct.
Okay, and then there should be a little thing hanging off the side that also has a cap. You have to undo that.
Okay.
All right. Take your blood, with your centrifuge tube at the bottom. You will lock the blood on the top, and I would put it on a flat surface on the table and transfer the blood directly into that tube. And then unscrew and get rid of that syringe.
Oh, wow. That's fancy. I had a bottle last night.
So rich.
It's like science class all over again.
Oh, cap it?
Cap it.
Cap it.
Yep, and now cap it, correct.
Okay.
Get rid of the syringe.
Uh-huh.
All right, and now we're gonna take that over to the scale, turn the scale on,
Okay.
Put it in the
and just place it on the scale, let it get its reading.
syringe. Oh,
Shape the.
yeah.
and then hit the button
Gloves
tear once
Is there gloves?
it got to the reading.
Okay,
Okay, did it tear and go
Yes.
to 0?
correct.
Alright, take the sample off,
Uh-huh,
and we can put it in the centrifuge.
okay.
So one of the ones that has the holders, right? Okay. They should be opposite each other. The black holders, the thick ones, you see that in there?
Yeah.
Leslie, it's holding it good. Okay, now grab your counterweight
Okay,
and put it on the scale.
okay.
What does it say?
Negative 1.4.
Okay, so you want to be plus or minus, you can be within plus or minus 1 gram, so we're still a little bit over.
Okay,
I would put that syringe and
Put it in here.
just very gently take out a little bit of water.
Do I just put the syringe?
Yeah, I'll do the syringe.
We were pretty close.
And then throw this away. Please.
And then we're gonna keep measuring it until we're at 0 or within that plus or 1.
Yeah, perfect.
What is it at now?
Yeah, so they're gonna, she's gonna put on either side of them to kind of spin.
So putting this thing though.
Because it needs to be bleeded.
No, it's not mostly. Oh yeah, it is blood.
0.
Alright, perfect.
Yay.
Usually
help me with
you
my
don't have to do
Band-Aid?
much for titrating, but, alright, so now you're gonna put it across from where you put your sample
Okay,
in the centrifuge
Look,
too.
you see my red dot?
So they're opposite sides. They should be across from each other.
I
Okay.
am a
Are they,
mom.
wait, are they across? I can't see.
See
Yes.
my red dot? Perfect.
I'm at 1 and 3.
I got this
1 and 3, okay, so like this, right? So they're in
Go
alignment,
into it.
Correct.
Here, wait.
not next to each other. Okay,
I
perfect.
take the glove off.
Close the cap,
I gotta get another Band-Aid.
and then there's gonna be arrows. Is it, what time is it set for?
That is hilarious.
No, we wanna get it to 2 minutes.
Okay.
My son can survive.
Once you get to 2 minutes, you can hit start.
Where's the cookie?
Right over here. It's put on.
Thank you. It's right there. Thank you.
So it's going through like the presets and it won't let me change it to the time. You said 2 minutes?
Yeah, just keep hitting the arrows. You give you different presets until you hit 2.
Okay. We're at 2.
Oh, you're there?
Yeah.
Okay, then hit start. So while that's spinning, I'm gonna walk you through what we're gonna do with the sewing.
Okay.
Yay! Alright, easy peasy. Okay, so now you have a few minutes to prep your bottles. You know, I got asked, how do you like package this? So when you take the cost of one serum and one kit, it really does not make any financial sense to only do one bottle to one kit. What the best way to maximize this, with the 20, you'll probably yield somewhere between 7 to like 11 cc's of PRP. So you could do a couple of things. You could use one kit and sell a 3-month supply. That's one way to use it. You can use the kit to do a PRP facial and a bottle of Sony, right? So there's different ways. I don't know what procedures you do there. Some places use this as a post-recovery serum for a basic procedure. So they'll drop PRP, they'll put it on, and then they'll say, take this and use this for the rest of the month. So there's different ways you can combine it. Ideally, when it was first launched, it was sold only as a 3-month skincare, but you will have options on how you think is best for the patient. Does that make sense?
Okay.
So you want to do the combo. All right. So you pull it out of the package, cap comes off,
Okay.
and you unscrew the top. I place that right into the cap so it stays clean. Okay. I don't know if you look inside.
Oh, I like that.
Sometimes there's a little film, like a membrane of the serum, right at the neck of the bottle.
Okay.
To minimize the risk of trying to put PRP that comes out, tap it on the table, and make sure that there's no membrane.
Okay.
Once this is done and we pull out the PRP, we're just going to add it straight to the serum take our cap, we're gonna put it back on, don't do, yeah. I'll put this, and then you have to invert it about 8 to 10 times to get everything mixed in together. Super important. Yep,
Where'd the
and
10
you don't
mil
wanna
go?
do none of this shaky.
Which one?
The
No
10 mil
shaking,
syringe.
you just gotta be gentle.
Got rid of it.
And then, I normally bring it over to the
Do you need
patient.
another one?
Hang on just a second.
Okay,
Because we didn't know you had to use it
I have
again.
one in the, injection room.
Because it was blood.
Yeah,
Or it was something. Because the other things were empty.
yeah.
any questions so far about the SOMI or anything we've covered, since we have a second?
This is exciting.
Ideally, I mean, you were saying there are 3 things we could do with this afterwards. I feel like we were talking even for several months ago about maybe sending it with the person to use for 3 months. What do you find people mostly doing? Or it's
just-
client dependent?
Can I just tell you, it really does depend. It's client dependent, but not even that. It's really like sometimes even the area that you're in is dependent. So
Okay.
for some people to say, there are some places that solicit you $1,500 for the 3-month skincare, and their patients will buy it. Then there's other places that you can't get them to pay $300 for the bottle.
Right.
That's a struggle. So, I think the need arose from where the providers were to say, hey, maybe my patient needs to build,
Sorry, Stephanie.
trust in this product before they want to do the 3 months. So they buy just like your serum cream. It's good for a month and it's at the same price point. So you can absolutely do Vivace
Right.
with a PRP facial and then send them home with a month of this.
Okay.
Okay, we're ready.
Okay, so don't stop that. Let it come to a complete stop on its own.
Okay.
So even though we're done, because it expands out horizontally, you have to let it slowly come back down so the plates don't get sheared in any way. It'll give you a little scoop or something when it's done.
Oh, here we go. Woo, magic.
Alright,
Turkey's
so
done.
It's smoking.
I just pull out yours.
Okay.
Okay, and gently I put it on the
Ooh,
table.
showed up there, showing what's
And
for them to see.
so what we're gonna, so you see how you get this gold PRP?
I'm golden.
You were.
Yeah, you
Liquid gold. That was beautiful. Gold is liquid gold. So unscrew the cap, and then you're gonna take your 10 ml
Syringe.
syringe, and then you will lock it. You've gotta be really careful. So you're gonna start drawing up the plasma until you see red, like the red blood cells starting to come up through that tube. Do you see what I'm saying? That tube
Yeah.
in the middle?
Yes.
Okay, so first you're gonna be getting the plasma, and at some point, you're gonna hit the red blood cells. So go slow as you get to the bottom to minimize. It doesn't matter if you have a few red blood cells in there. This is all condensed plasma. So at this spin, we're at 2 to 3 times the baseline. If I wanted to condense it more for injections, then I would pull this plasma out. We have another type of kit, and then you would spin that down even further.
We need 2 Douglas.
Yes, we need 2 Douglases. That is
So yeah, you can draw it out. Sometimes you might
Right,
get
then.
more than the 10 cc's. Where are you at?
right where the blood's coming.
Okay, we're ready.
She's at 10.
Yeah.
Okay, so unscrew
Getting every
that,
drop of
and
that.
get rid of that container too.
Okay.
And the first thing we'll do is we go to, for the Somi skincare system, each bottle, ideally you want to get 3 cc's. You don't want to put in more because everything is ratioed in here. The food source, the space, all of the
I'm really excited. We were
available
gonna get you really jazzed up.
micronutrients that are there for the cells. So 3 cc's is what we want to go to. But
Okay.
for studies, you can have as little as 2,
Put another
but
bottle.
ideally the range is 2 to 3
Right.
cc's. So for his, you have plenty. I would just put the full 3 cc's in there.
Okay.
Okay.
He needs it.
I'm old. Grandpa needs
Those are making me giggle.
it. Sorry.
Okay.
All right, and then we screw the cap back on. I always add the lid to it afterwards.
Okay.
And then we
And then you
tilt
need to
it 8
invert it
times.
at least 8 to 10 times. Not shaking, but just like light inversions to get everything mixed in together. And then when you're done, I mean, now is like your teaching opportunity. I'll sometimes, patients hear the questions. Does it have a smell? It really doesn't have a smell. What is the texture? It's very light and it's easily absorbable. So you have to prime this, just like if you buy a new shampoo bottle or a hand soap. So take the cap off. I would put, your patient's hand right under
Okay.
and teach them that. So they're gonna have to prep the bottles. And then you have to pump it. I don't know, sometimes it's like a whole bunch until you get your first.
How much should
And
he?
you want to give them like 2 pumps.
Oh, 2.
Okay.
Okay, so you have 2 pumps in your hand now. I would just spread it and put it kind of lightly
Okay.
everywhere.
Okay.
Did we get a before picture?
Perfect.
Oh, yeah, where's
So
the camera?
just kind of
I'm
gesture
recording,
it over
actually
the
probably nothing now because my
Yeah.
phone moved.
Right?
Take a picture.
neck,
It should be done
everywhere.
on
So
Glen's
face,
face.
neck.
Hmm?
It should
Okay.
be done on Glen's face.
I
You didn't
Clean
have
enough.
any
You're clean
moisturizer,
enough.
nothing?
Well, I
But we just want
moisturizer
to
on.
spread it first.
He has
And then-
moisturizer on. Is that a problem?
It's okay. I mean, we're just gonna use this for
Okay.
training. It's not
Okay.
gonna.
Oh, we want him
But
to.
yeah,
We want him to look so great. We're doing before and after.
And then you want to work it in circular motion. So gently put on, but now, you want to work it in, and eventually, like if you've ever used PRP, you'll know that it gets tacky. There's like a tacky phase. You still want to rub it past that phase to make sure we're breaking all of those cells until it's fully absorbed. It should happen in like usually less than a
Can you
minute.
see on here
But because he has moisturizer, it might change.
on my phone?
So this is what we teach our patients. You got this product now, it has PRP. This is stable, viable for 14 days. After 14 days, if you don't refrigerate this, you're gonna start having die off of the cells. So I just tell my patients, when you get home, refrigerate it. Once it goes in the refrigerator, it stays in the refrigerator.
Yeah.
You take it out, you invert it 1 or 2 times.
Again.
You'll put 2 to 3 pumps. You're gonna spread it, and it feels cold. If it's too cold for them, they can like warm it, prior by rubbing it in. But they're gonna spread it, and then they're gonna start rubbing it in until it fully absorbs. It's the first product that you're gonna put on after you wash your face in the morning and at night. Dry it off completely. It's the first product that needs to go on. Once it's fully absorbed and it's dry, then you can add any other product you want in conjunction. There's no contraindication.
And do this AM and PM?
I'm sorry?
AM and PM, Christine?
Yes, you want to use it twice a day, AM and PM.
We actually bought all the little refrigerators so that when someone does this, we send them home with a refrigerator.
So usually, and again, because normally the way you get the refrigerators are for the patients who buy the 3 months,
Right.
they got the refrigerator. I don't think you'll have enough for if you sell 1 bottle to give that refrigerator to everybody.
Right.
But that's kind of how it was designed. If you buy the 3-month supply, then you got the fridge with that too. And the fridge just,
Well, and that's what we were
Point.
thinking. Whoever bought the 3-month supply gets the fridge.
Yeah, but the fridge too was meant to be a warmer or a cooler, so make sure you instruct the patients when you get home, make sure it's on cool,
Yes.
not warm, this has happened. So that they put it on the cool setting and let it run for at least an hour and a half before they put the product in there.
Okay.
And that's meant so they have it at point of use, right? So by the bathroom, the vanity, by their bedside, they just grab it and put it in. Because what you don't want them to do is pull it out and leave it out.
Right.
You will have some die off, but you still should use the product all the way through.
Excellent.
Any other question? I mean, putting it in is really simple. There's nothing really complex about that. It's more about learning the centrifuge that is I think, the learning curve. Any feedback with that? I think that went flawless.
Yeah, that was easy.
That was
Okay,
good.
so, and in that box, okay, you asked me what the blue caps are, and there should also be stickers
Yeah.
in that box. There was like folded instructions. If you ever forget, there's like the folded instructions that will walk you step by step, and these stickers. So I do a couple of things. I used to just write on the box the expiration date, which is 90 days from the time that it's drawn. But this is only a 30-day supply. They'll probably get a few more out of it. And trust me, people will know that, and then they'll start pumping more and putting it in other areas. but they'll get at least a month supply, but the expiration date is 90 days from time of draw. So today is the 18th, 8/18, this will expire 9/10/11/18. I write that, I put their initials on there, and then I put expiration date 8/18, 11/18. So I used to put it on the box, then I forgot that everybody throws the boxes out. Not everybody wants them because they're big, even though they're beautiful, they're bulky. So if you throw the box, then you lose that opportunity. And then if they buy all three, or even more than one, I also label them like number one, number two, number three. So it kind of keeps them, on track of where they are. But they can use any which way they want.
Keep you on track.
That's perfect.
Wow, you have amazing.
Look at
You
you.
did it, you guys, that's a lot. I thought you were making it earlier.
Something
Yay.
that was awesome. You were great. I was gonna fall down that way.
Hey, and so you should do
But I
something
did.
like a before and after.
Yeah.
For him, just how he likes it even after a month. But again,
You
that's
gotta do
why
it
he
night
said,
and day.
I know.
You're going on the website, you know that, right?
over time with continuous prolonged use. So that's why the next study is 16 weeks to say, hey, we know what happens at 4 and 8. What happens if we do it at 16? And so that's that second study, which I think should be it's already been accepted, so it should be out for publication by the end of this year.
Super.
All right, any questions, you guys? Whew.
I don't know.
Bathroom break, coffee break. I'm done. So
Wow.
obviously I'm very easy to get a hold of. You can call me, text me, email me if anything else comes up. But I'm looking forward to your live training. They'll have plenty of resources there for you, kind of putting it all together. Hey, those blue caps that I still didn't address. You have extra PRP in that syringe now, right?
We did, it's gone now.
Okay, well, you could just easily, that's like a lure lock cap.
Okay.
So say they were doing a facial and you need to walk it to a treatment room, you cap it, you leave it there for whoever was gonna apply it. So you can, you guys technically could have taken it home or done whatever you wanted. You could have put the extra on your face directly, but but that's what the caps are for. They're meant to lure lock that syringe, and if you want to save that PRP or transfer it to a room,
The
or
end's not capped.
because you want to do, you put your SOMI and
Otherwise
then you
it
have this extra, and they're using it for a treatment. That's how you transfer it kind of clean as possible.
Okay, thank
All
you.
right, guys.
Thank you,
Awesome.
Christine.
Thank you.
Awesome.
It would have messed up our before and afters anyway.
Bye, everybody.
Thanks again, Christine.
So obviously we have some logistics issues.
Put it on another part of your body.
Our goal is to eventually have a nurse at all of the facilities all of the time, but we're obviously not there. So if you have somebody that wants PRP and you don't see a nurse around, give me a call and I will
was
come.
thinking
But
about going to school to do it.
or we can get people trained for phlebotomy
I
and
was thinking about doing it because my one girlfriend in Chicago, that's what she does, and she works for a plastic, and she's like, "You should go. It's only like a six week program."
Yeah.
I'm like,
it's 6. I mean, I'm like, oh, I could just train you in 10
Yeah,
minutes.
I know.
But
I used to have to do it to myself for various reasons, and I learned on an orange in about 20 minutes. So
Did you
yeah.
really? Oh my God.
wow.
Yeah, I know.
Diane, wow.
I
Well, we have
All
Diane on standby too.
know.
okay, well, does anybody have any questions?